Hi, everybody. It's Tara from Sojourn Psychology, and I'm here with Lisa Rowbottom, who is a registered psychologist that works at Sojourn, and she also works at the Alberta Hospital. So Lisa and I have been talking about doing a little video on accessing emergent care for a while now. So we finally got our schedules synced up and are having a chance to actually have that conversation here today. So Lisa, what would you say is important for people to understand when they're seeking emergent care?
I think, first of all, to understand whether you're dealing with something that's considered emergent care or urgent care, there's a difference between the two, and that's going to determine where you're going to go. So what we consider emergent care is something that within the next hour or so, possibly immediately, is going to turn into a mental health crisis. So those are things like you start hearing voices after you've used medication, you are actively considering suicide and are working on a plan to actually do it. Things like you're starting to feel maybe quite depressed and it's heading towards the suicidal type thoughts. So you're looking at, for emergent care, very specific emergency things, and that's when you want to go to the emergency room. And that's when the psychiatrist there will look at you and look at your meds and consider possible hospitalization for periods of time. Urgent care, on the other hand, is a crisis that is going to become an emergency within the next, say, 24 to 48 hours. So these are things like you're feeling quite depressed and your thoughts are starting to go towards suicide, but you've not actively committed to attempting. Or things like you're dealing with a really problematic situation in your family and you feel like you're just breaking down, but you can, manage to go to one of the other options in the city as opposed to an emergency room. So the options in the city for urgent care are Access 24/7, which is located in the Alex Hospital. And that's really Alberta Health Services gateway. They consider it into the mental health system. So if you're looking to get into some sort of treatment from psychiatry, something like that, that's where you're going to want to start. The other option is the mental health clinic on 112th Street, and it's going to have access to psychiatry. It's got a walk-in clinic that you can access as well, and that way you won't have to sit in the emergency room with possible COVID cases or anything like that.
Awesome. Okay, that's really useful information. And I think it's like maybe a big misconception that I see people having is everybody thinks we need to go like the Alberta Hospital if we're in a difficult mental health place. But what would you say to those people, Lisa?
Well, first I'd say Alberta Hospital doesn't actually direct admit anymore. So the route to Alberta Hospital is through the emergency room. And you are looking at a variety of options. Many of the hospitals will have mental health boards that do, say, a week-long stay, 3 days, even overnight, something like that. And it's not always that the doctors are going to force you to stay if you're doing unwell. They may make it a suggestion, give it as an option to the people who come in with you, anything like that. And if you are someone who is struggling with a very severe mental health issue and they're unable to stabilize you on medication in one of those other hospitals, or you need further rehabilitation, then they'll transfer you out to Alberta Hospital. So it's not, yeah.
Yeah, sorry, I interrupted you there, but that's a useful way of explaining it. So just basically any emergency room like Sherwood Park Emergency or one of the other hospitals in Edmonton will be a place where somebody could start to seek accessing some type of mental health service.
Mm-hmm. Yeah, ideally access 24/7 if you can, but if that's not an option, then any emergency ward.
Right. That's a good thing too. Like you said, it's if we access the clinic on 112th or access 24/7, that really puts us at less risk of being exposed to COVID-19. One other thing too, and I know you know this as well, is sometimes if a person has a psychiatrist involved, like the psychiatrist can be another way to access to more emergent care if it's needed.
Absolutely. There's
Yeah.
other options as well in the city. You can, if you're with someone who you're concerned is becoming mentally unstable, you can also call our PACT team. It's PACT. And what that is it's a team that's combined with Alberta Health Services mental health teams and EPS and their mental health specialists. So if you're with someone or you're unable to travel to an emergency department and you know that the situation is unstable because of a mental health crisis, you're able to contact that team and they will come to you.
Awesome. Okay. And that, not to sound completely like I don't know what's going on, but I have a silly question maybe, that's the mental health crisis unit. Am I right? PACT?
Yeah.
Okay. Okay, cool. Yeah, I couldn't remember if they were two separate things or if it was just a different way of saying the same things. So,
yeah, it's the same thing.
Yeah. Okay, that's really useful information. So I'll try to include some of those descriptions below in the text of this vlog. And again, if you have any questions, you can always call 211 as well. I believe you can still call 211 or just call an emergency room hospital to see how busy they are if you're going to go. And sometimes they can give you information on who is less busy at that specific time. Okay, thank you so much, Lisa.
You're welcome.
Okay, bye-bye.
Bye.